here to share with you the overview of my organization, Thai Health Promotion Foundation, or Thai Health in short. As Khun Rangsan mentioned before, the Ottawa Charter for Health Promotion provides a paradigm shift in addressing public health issues by emphasizing the crucial roles of non-health sectors and socio-ecological approach to public health. It encouraged the collaborative approach to health promotion that aims to promote health through addressing the social determinants of health. That include factors like individual lifestyle, living and working conditions, and more other social conditions, as well as access to the healthcare. In order to address the NCDs which caused by the unhealthy lifestyle and also to achieve the sustainable development goals. Let me share a little bit on the arguments that we advocate to the policymakers in setting up Thai Health 20 years ago. First, the high burden of disease from NCDs. Like in many countries, NCD is the leading health threat in Thailand, and to develop policy to address the risks is challenging because both health sector and non-health sectors such as trade, agriculture, transport, etc., often develop incoherent policies due to conflicting mandates. But the organization like Thai Health can work across sectors to address the risk factors of NCD. The second is the rising healthcare cost. Of course, having a new organization that enables people to be healthy will help them to spend less money for healthcare. Third, existing healthcare system focus more on curing the sickness rather than promoting good health. So it was more like sick care, not healthcare. Fourth, in morality aspect, the tobacco and alcohol industries should pay the extra tax to society, and the government should use the revenue to solve health problems caused by those harmful industry. Last, the need to strengthen health promotion hand in hand with UHC, because sustainable health promotion can help reduce government's burden of healthcare and allow for UHC to be financially feasible, especially in the long term. For the overview of Thai Health, Thai Health is an autonomous state agency that supports health promotion movement in Thailand. It was established via Health Promotion Act of 2001. It receives an innovative and sustainable funding from 2% surcharge tax on tobacco and alcohol products. Thai Health is overseen by dual multi-sectoral bodies, which are the first is the Board of Governance, comprised of 21 members, chaired by the Prime Minister. The board has authority to set policy, regulations, strategies, and budget, as well as oversee the management structure and other guidelines of the organization. Second is the Evaluation Board, comprised of 7 members appointed by the Cabinet. The responsibility of the Board of Evaluation are to evaluate the overall performance of Thai Health in relation to policies, activities, and operations to ensure accountability, transparency, and efficiency. And this is the structure of the Board of Governance. The board comprises of 2 politicians, which is the Prime Minister as the chair and Minister of Public Health as the first vice chair. 9 senior officers representing relevant ministries. 9 independent experts or social leaders in various fields such as law, sport, mass communication, community development, and many more. And the CEO served as the board secretary. The multi-sectoral composition and the monthly board meeting also proved to be useful for continuation of policy direction, despite the relatively frequent change of politics and government representatives. Thai Health income is from the new source of money, which is 2% surcharge on top of the excise tax from tobacco and alcohol products. The amount is 130 million US dollars in 2019, or around $2 per Thai citizen, which is not very much. I would like to stress that the 2% was collected from the harmful industry, not from the government's wallet, who still collect full amount of the excise tax under their jurisdiction. However, our budget is still very small proportion compared to the budget and expenses of the Ministry of Public Health and the national health expenses or the government's overall expense. When compare ThaiHealth budget with the Ministry of Public Health plus National Health Security Office or NHSO budget, it shows that from 2010 to 2017, ThaiHealth annual budget is only 1.4 to 1.9% of the budget of Ministry of Public Health and NHSO combined. Thus, the innovative funding like ours is used as a multiplier or a catalyst to synergize and leverage the conventional and much bigger pool of budget. It should not be used for the same as routine work of the government because it will not make much difference that way. Besides Thailand, other 80 countries also use earmarking for health, with 54 countries earmarking sin tax for health purpose. Among those 54 countries, 35 of them receive or a portion of revenues from tobacco tax. 9 of them receives revenue from tax on alcohol sales, and 10 of them got revenue from tax on other goods that can negatively affect health, such as sugar, sweet, and beverage. Maybe you should think and discuss with us what is the base source of this sin tax in your country context due to our discussion segment later. And this is a sample of how countries use sin tax for health. For South Korea, the financial resource for health promotion fund come from health promotion charge levied on tobacco products. Philippines earmark tobacco and control and alcohol tax to help achieve UHC through subsidized insurance coverage for the poor. And for Vietnam, they use earmark tobacco tax to generate sustainable funding for tobacco control. ThaiHealth's mandate translates to 15 master plans as shown here. We have plans that focus on health issues such as alcohol, tobacco, road safety, food, physical activity, etc. We also have setting-based plans focusing on promoting health in community, organization, family, as well as vulnerable populations. And lastly, we also have supportive system plans such as social marketing and capacity building. Most ThaiHealth plans were proactively implemented through strategic partners which include both government and non-government organizations for tackling major issues like tobacco and alcohol control, food, physical activities, health system. Proactive grants account for 90% of ThaiHealth budget, while 10% is for open grant, which are micro grants that open up opportunities for local communities around Thailand. As you may now see, ThaiHealth's multi-sectoral approach is at the core of our working scheme. We work with partners, both individual and organization, not only from the health sector, but also other sectors, including government agencies, private organizations, civil society organization, university, and local community. Since 2001, ThaiHealth has collaborated with more than 20,000 partners by granting more than 3,000 projects per year. And this shows our core strategy called the Thai Power strategy. It is created by Professor Prevalence as a way to overcome a very tough social and health challenge. The Thai Power includes the power of knowledge, the power of social mobilization, and the power of policy. ThaiHealth put efforts and funding to strengthen each power aspect and then coordinate them with an aim for structural change towards a healthier lifestyle of the people, as well as better social and physical environments for health. This is for knowledge power. ThaiHealth and our various knowledge partners generate pertinent and up-to-date knowledge and evidence that support healthy policies and healthy literacy. This is valid and relevant knowledge created through research and study, help inform policymakers and assist them to make more informed decisions. For social mobilization power, ThaiHealth mobilizing social actions of civil society, communities, campaigns to advance their own health and well-being. We do that by both air war through various media and by supporting the grassroots activity or the ground war. This power plays an important role in activating campaigns and surveillance related to the health promotion. For the policy advocacy, if policymakers are empowered by the previous two angles of knowledge and societal view, they can make new healthy policy or improve old policy when the window of opportunity is open. The law enforcement is equally important to make policy truly meaningful and not just a piece of paper. The power enables systematic and structural changes conducive to good health, creating a broad impact to general public. And this is an example of tobacco control movement in Thailand. On knowledge angle, we have been a major funder for the TRC or Tobacco Research and Knowledge Management Center to conduct research and generate evidence much needed to drive good tobacco control policy. On the social mobilization angle, we have collaborated and campaigned with many civil society organizations and professional associations. On the policy angle, ThaiHealth supports the Ministry of Public Health to enact and enforce laws and policy. The work of ThaiHealth and our key partners leads to many achievements, such as the new tobacco product control of 2017, the increase of tobacco tax, and measures like prohibition of tobacco advertising in all media and pictorial warning. The work of ThaiHealth and our partners lead to the key health outcome, such as smoking prevalence in Thailand has come down steadily over time from over 30% in 1991 to 17.4% in 2021. The alcohol drinking prevalence among adults more than 15 years old show a declining trend from 32.7 in 2004 to 28.4% in 2019. And the alcohol consumption per capita from 1961 to 2004 show a jump of 3,300%. As the alcohol culture has been rapidly growing in Thailand in the past, back then drinking was common in cultural events such as Songkran or Thai New Year, where alcohol could be found everywhere, leading to many harms and inappropriate behaviors. But since ThaiHealth initiated social movement in 2003, you can see that the alcohol consumption per capita from 2004 to 2014 show a slight drop by about 20%. One of the approaches that ThaiHealth and our partners use to solve this problem is to shift the social norms towards non-alcohol cultures and supporting better alcohol control laws. The alcohol consumption at harmful level or the heavy drinkers also has decreased over time for both male and female. On physical activity, the number of runners for health in Thailand have increased from 5 million runners in 2012 to 11.9 million in 2016 and to about 15 million in 2017. It shows the increasing trend over time, but unfortunately since 2020, the COVID-19 pandemic and government restriction measures have resulted in the decline of the runner numbers. From the World NCD Progress Monitoring Report in 2017, Thailand was ranked the 3rd in the world and the 1st in ASEAN, with fully achieving 12 out of 19 targets. And next, I will share with you one of the social innovation called New Year Prayer Initiative. Since the traffic accidents on New Year's Eve had been continually increasing every year due to celebration and partying, which include alcohol consumption. So ThaiHealth and our partners promoted this alternative activity for celebrating the new year by convincing the people to pray for a good start of the new year instead of celebrating wild parties. So this campaign enjoyed cultural and religious acceptance. It can be seen from the number of people who participated. In 2014, more than 17 million people participated in more than 11,000 temples countrywide.